I guess one of my questions would be, if you don't mind if I borrow Penny here. So a lot of the time at this posterior kind of fourchette, or that area above the perineal body, we see a lot of women, obviously with postpartum or perineal trauma here, but also there's like a flattening that occurs. Now we understand the flattening to be a change in the fascia, that the fascia got really stretched, whether it was from a quick delivery of baby's head exiting, or if it was from a really prolonged birth process that as baby was exiting, it was just pushing and stretching. But have you ever used any of your techniques to help bring that a little closer together, or even for perineal trauma?
I have not, but that's not a bad idea, because I use PRP, I'll microneedle it on faces to help with a little bit of scarring. I think it would be pretty well tolerated with a little bit of topical numbing cream in that area. So I'll definitely give that a try, and I can let you know if I'm getting good results with it.
Yeah, that would be great to know. Because I think, again, like, not that many people see their scar. After a while, it does just kind of fade into the background. But sometimes those scars can be very sensitive, or also the tissue behind it has lost a lot of its elasticity. So just a thought.
Any scars that patients are experiencing a little bit of neuropathic pain, you can put a little Botox in the scar itself. It actually stops the signaling of nerves in those areas, and it can help tremendously. So if women are experiencing pain in that area and they have some scar tissue from delivery, it is possible to put just a couple little wheels of Botox there to help with that.
I've had a client who was having a lot of pain from her cesarean scar, and you know, her birth was maybe 7-8 years ago. And she ended up eventually finding a cosmetic dermatologist who did some injections into her cesarean scar, and it helped improve her scar pain like so much.
Yeah, no, that is an option that a lot of women don't realize either, is that you can use Botox to help with just stopping the signaling of pain in that area where they're scarring. A lot of women that have had breast cancer post-mastectomy have the scarring, and they just experience, you know, nerve pain. They're taking gabapentin, you know, God knows what they're taking. And that is an option that you can just get a little bit of Botox there. It usually holds true for about 4 months, and then you just get a retreatment.
How early can people come see you after having a child, or, you know, maybe even going through like a cancer treatment, that they are feeling these changes in their vulvar tissue?
Yeah, so if you're actively going through a cancer treatment, I think it depends on what the cancer is. We just want to make sure that the blood that we're taking from the patient and we're reintroducing into the body, we just want to make sure we're in the clear with that. So patients that are actively going through chemotherapy, let's say, because I do have patients that are actively getting their hair treated, I just want okay from whoever their specialist is. As long as the specialist says it's fine, then they can come anytime they want. Like I said, PRP, there's like 8,000 studies out there, really no complications at all. So it's your own blood. So really it's going to help repair things rather than set you back with anything. So I would say you can come in as soon as you'd like. But of course, you know, I would like to get the okay depending on how soon you want to get treated after having a child. I would say at least wait a couple of months. You know, your hormones are completely crazy. I'm not a fan of treating patients that are breastfeeding. I would rather you be finished with your breastfeeding and take that time with the baby. God forbid something happens, you know, even though PRP is super safe, I would never want any risk of infection that could potentially be passed over to a child. So that's really my only rule, is no breastfeeding, not while you're pregnant. Let's wait and see what your specialist says if you're actively going through any type of cancer treatments. And that's pretty much it.
Yeah.
I know. Now my mind is just spinning with like all these different things.
All the ideas and the possibilities. Because in our office, we do have the ability to use not radio frequency, but shockwave therapy. So low intensity shockwave therapy. And we're dabbling in it, trying to find like what works and where it works. And one of the contraindications is not to use it with somebody who's had cancer in an area. So I think that that's an interesting kind of, you know, avenue for people to go down if that is something that they've been concerned of. And also, you know, the shockwave therapy actually takes about 6 visits versus maybe 1 to 2 Botox or PRP treatments. So really an interesting kind of, to weigh your options for clients.
Yeah. Well, and we are able to make recommendations for clients too, as far as certain products, like you had mentioned hyaluronic acid. So we are able to recommend different suppositories or vaginal or vulvar kind of moisturizers that contain the hyaluronic acid to help kind of build up that elasticity and that strength. But it's an incredible being able to combine that with,
gosh.
PRP. Just imagine,
Gosh, there'd be beautiful vulvas.
Yeah.
All over
I know.
And happy vulvas, like happy sexually aroused vulvas.
Yeah.
Like that's the best.
And honestly, it's interesting because if you're not feeling good down there, it completely it changes your day. You're worried about things, mentally you're not sound. If you can make your lady parts feel better and you're having better sex and you're peeing better and you just overall feel a little bit more well, it's going to change your whole attitude. You're going to want to do more things. You're going to want to finally get dressed up and go somewhere. And it's just healthier. When you feel good in your body, it changes your whole overall demeanor when you're out there in life doing things. So I feel like that's so important. And a lot of times patients come to me and they think what's going to fix them is getting Botox or getting their lips done.
Right.
And after talking to them for a little while, I've started learning, there's a psychological component to why people walk in my door.
Right.
Unless they've been getting Botox forever and they're just here for their quick, Botox fix and then they leave. As soon as someone starts saying, I don't, something's wrong with my face. Can you fix this? Can you do this? I just don't like the way I look. And they can't quite put their finger on what they don't like. That's when I start sort of venturing into how's everything going on at home? Is something going on that you want to talk about? All of a sudden I got a divorce. This happened to me. This is what's going on. And it's not so much they want to come in and get their cheeks done or they want to get their lips done. It's more about they want to start feeling good and they don't really know how to feel good. They need help feeling good. Right. And a lot of times I'm not going to do anything that's going to help them. And it's just a matter of, sitting there and actually giving them your ear and talking to them for a good 30 minutes. And then they know what to do to start getting on that path to feeling better, whether it's mindful based meditation, taking an 8-week course through Jefferson or something, or, getting the O shot and they can go home and finally start having better sex. So I think it's really important in my industry, and it's a very fast paced industry. And a lot of times, providers can't give patients that, allotted time and they just want to do a procedure and get out of there. I feel like I would say 50% of my patients that come in, even if they're established patients, there's also something else going on. And I think it's so important to really have your patient trust you and have that door open so they can start inviting you in and allowing you to help them, even if it's not a service that you're providing. So being able to refer patients to you guys and being able to refer them to, one of my psych nurse practitioner friends, if there's something going on that they need to talk about. So having those connections is so important in the outpatient setting.
Absolutely. And I think we were just talking about that this morning of how someone feels about themselves. It almost turns into this like catastrophizing kind of feel when something changes, whether it's after having a baby or after going through fertility issues or menopause. Sometimes those things can be so striking to us. And then once we do start, I know Becca referred to, another gynecologist for just a little cream for estrogen. And the other gal was like, oh my gosh, like I actually have pink skin now and things are changing. And it's just, when we finally are comfortable talking to somebody about our lady parts, there's so much more that flourishes from that. And I think that that's really just beautiful that you're taking the time to listen to those things as well. Because we hear that all the time. And ask about those things. Who else?
Like you said, no one talks about it. I think there's a lot of shame that we feel about those parts of our body, for, society and all of that we put on ourselves. And just the emotional component. So many people who are going through struggles just totally kind of disconnect from that area in their body, and a lot of emotions and stress and tension kind of gets placed in that area as well. So I mean, when I have postpartum moms who are coming in, or anyone really, as we're just, you know, the first thing that we're doing, we're always just looking and observing like the posture and the tissues of the vulva, because that can just give you so much information alone, just being able to look. And you know, I'll ask my clients, like, have you looked at your vulva? Like, do you do vulvar checks? Have you looked at your vulva? And most of the time it's like, oh God, no. Like,
Yeah.
I don't want to know what's going on down there. No way.
Yeah.
Like, very rarely do we get people who are like, yeah, I check every, I'm like, great. They're like, that's fantastic. Like, I'm so excited when we have someone that actually does look, you know, their vulva. But a lot of times it's people are scared. They don't want to know. They feel so like traumatized from everything that's kind of gone on, that I think part of what we do is just encouraging women to be accepting and open, and respectful of their bodies, and wanting to become more curious about it, but in a way that's feeling comfortable for them to open up. And we'll get people all the time who are coming in and they say like, well, you know, I want to get rid of my like mommy tummy or something for a diastasis. And then as we start talking, you're unveiling all of these other things,
like insecurities or different.
Yeah, it's so funny where it's like, oh, you think someone's coming in for a simple this, and then you end up talking to them for an hour about everything else going on in their life beyond, you know, the physical, but like, how are things going at home? What is your support like, you know, with your kids? How's your job? You know, so there's so much beyond, you know, the services that we provide that goes on in our appointments. And it sounds like you share that with your clients as well. And I think that's, you know, why you're so busy as you are. You know, anyone can walk in and get Botox.
It's a great segue. The Botox and then they unload and they tell you all these things. I'm telling you, it's good. It's good. Botox is there.
It really is. No, it's amazing that, you know, that's why we love doing these conversations with people, because we're finding there's many providers out there who want to listen and want to provide this very holistic approach to care. So thank you for what you're doing for our external, you know, genitalia presentation, but also like our faces and all of that. There's so much more than just that.
And just so all the listeners out there realize, I actually love it. Don't feel when
we love our job too. Exactly.
Yeah, I wouldn't be doing it if I didn't love it and I wasn't passionate about it. So when patients come in, they're like, "Oh, I'm so sorry. I don't know. Do you want to even look?" I'm like, "Yeah, show me."
Exactly.
I don't care. Just, you know, you know, we're all different. We all have our insecurities.
Exactly.
You know, who cares? Pull your down. Let's get
So, put the gloves on and let's go.
Yeah. And I make it a very, a lot of times my patients are curious about what the experience is going to be like. I have essential oils. I keep all different types of crystals. I believe in crystal energy. I play meditation music. I dim the lights. I make it very comfortable for you. If essential oils aren't your thing, I don't just whip them out. So don't, you know, some people don't like that. They don't like aromatherapy. They don't like crystal energy, but they love the meditation music. So I always make sure that I talk to them prior to doing anything so that it's the best experience for them. You don't walk in the door. I don't just start, you know, putting gloves on and it's cold. And I just start doing things. We ease into it. We talk about it. I never just get started. You know, it's a very nerve-wracking thing, regardless as to whether I'm doing just a couple of shots of Botox, I'm doing PRP for your hair, or I'm, you know, having you show me your lady parts. So I believe from the moment you walk in the door, you know, let's just relax a little bit. We'll get started eventually, but let's first get you really comfortable. So I just want everyone to know that that's my style. That's how I roll. And you know, we always talk about everything that will make you comfortable before it's rock and roll time. So
same thing for our office.
Yeah, definitely. I think our favorite thing is when you know, you have someone coming in who's very you can tell they're nervous, timid, and shy. And then at the end of the appointment, they're like, oh my gosh, I can't wait to come back.
Right.
Or like,
Yeah.
that was so fun. Or this is the highlight of my week. And you're like,
Wow.
yeah.
It should be an experience, and then you're going back home and you've got your kids, or you have like all your responsibilities you have to do. You don't want to make it a chore to have to go get something done to make your life better.
Exactly.
It should be something that you're excited about doing and embracing it and really following through with it, and then trusting the process if you have to come back and have a second treatment. So, comfort is key. Listening to your patients, as you girls were talking about, is essentially super key. And just being there to hold their hand throughout the entire process. So
yeah, no, and that's why we were connected together. For everyone who's listening, we were connected together, Breathe Life PT and Sara, by our nurse navigator, Kate Krause. And I know you and Kate go back working together in ways. So it's just a really cool community that's starting to, that is growing in South Jersey, of like-minded professionals who are not just doing the norm pelvic health or the norm cosmetic procedures, or even just like the norm like gynecological services. Like there's so much more that's coming out, and that's our whole goal, is to help people find the providers who fit best with them, because that is truly when we can heal our whole self and get to all the different layers and the beautiful facets that make up each one of us. So Sara, that was amazing.
Yeah, and it's so funny, like as everyone's sharing their story, how similar everyone's story kind of becomes of, oh, I started out in this, and then no, I don't, no one, I don't know, maybe some people from a young age have a passion for working with like sexual health or, women's health. But I think so many people we meet along the way, they started somewhere and then it's just been this calling or this pull, and it's become their passion. And it's just really, refreshing to be able to meet people in the area too that share a similar passion, and be able to expand our network, to be able to help the ladies that come through our office too. This is one of the reasons that we do this, so that we can, everyone who walks into our door, we can only do so much. So we're constantly thinking of, okay, what other holistic things can we add into?
You're never alone. I feel like that's one of the big things people say. Like, I never felt alone even when I stopped seeing you guys. Like there was always somebody that you were referring me to.
So thank you, Sara. That was really, informative and exciting.
Pleasure.
How, if people are seeing this or interested in working with you or contacting you, have questions, what is the best way? How can people find you?
Yeah, so I would say I am surprisingly my most responsive on my Instagram. If you send me in a DM, if you have a lot of questions, I'll set up a call with you, or I will refer you to my work email. I don't put my work email out there just to kind of protect from all those, people out there that are a little cray. But I will give you my work email, and then you can send me lab work. We kind of talk that way, but I would say most responsive through my Instagram. Shoot me a DM, just say what you're interested in learning a little bit more about. I will always get back to you, and I will always let you know the best way that we can communicate so you can learn a little bit more.
That's great.
Yeah, and we will make sure we share your Instagram handle with everyone too, so they can find you.
And if you want to, we'll share it now too. If you want to connect with Sara on Instagram, go ahead.
Well, it's at Sara Cole _RN. And it's Sara, SARA, no H.
No H.
No H.
Yeah.
Yep.
That would be great. And then that way people can connect with you. And we'll also, have it in our newsletters where people can connect with you as well. And, where we post this, it will be there too. So you guys can always find Sara if you need her for any of your.
Yeah. And then I do have a just www.nursesara.com, and I'll put out newsletters if you subscribe, just new studies that come out, things like that. So
yeah, we'll be happy to pass that on.
I'm going to
people
subscribe
as well. I know, me too.